6 signs of diverticulitis you should never ignore. What if I told you that a condition silently develops in the bodies of over half the population over 60, and many won't know they have it until it's a medical emergency? This isn't some rare exotic disease. This is diverticulitis, a painful and potentially dangerous condition that's on the rise, especially in younger people. In fact, the incidence of diverticulitis in people aged 40 to 49 has skyrocketed by 132% in recent years. You might be thinking, I'm not in that age group, so I'm safe. But a surprising number of patients with acute diverticulitis are under 50. What if some of the everyday aches and pains you're dismissing are actually early warning signs of something more serious? What if the healthy foods you're eating are actually making things worse? And what if there are silent red flags your body is sending you right now that you're completely ignoring? In this video, we're going to reveal the 6 signs of diverticulitis that you should never ignore. Diverticulitis occurs when small pouches, called diverticula, form in the wall of your colon and become inflamed or infected. These pouches are incredibly common, affecting more than 30% of US adults between 50 and 59, and over 70% of those older than 80. While most people with these pouches, a condition known as diverticulosis, will never have symptoms for a significant number, it can progress to diverticulitis, leading to about 200,000 hospitalizations in the United States each year. So, if you're ready to separate fact from fiction and learn the real warning signs, keep watching. Please note, this video is for informational purposes only and not a substitute for medical advice. All information provided has been carefully verified. Source links are available in the description. Now, let's get started with the most common one, lower abdominal pain. The first and most critical warning sign of diverticulitis is lower abdominal pain, specifically in the left lower quadrant of your abdomen. This isn't just any ordinary stomach ache. It's a distinctive, localized pain that occurs when small pouches in your colon wall, called diverticula, become inflamed or infected. The medical term diverticulitis literally means inflammation of these diverticula, and the pain you experience is your body's alarm system alerting you to this serious condition. The Harvard Medical School diverticulitis study demonstrates that left lower quadrant pain occurs in 70% of patients with diverticulitis in Western populations. This pain pattern is so consistent that doctors often use it as a primary diagnostic indicator. The location makes sense anatomically because in Western countries, diverticulitis predominantly affects the sigmoid colon, which is positioned in the lower left part of your abdomen. The characteristics of this pain are particularly important to recognize. The onset is typically sudden rather than gradual, meaning you might go from feeling normal to experiencing significant discomfort within hours. The intensity can vary dramatically from person to person, and even from episode to episode in the same individual. Clinical studies confirm this pain pattern is remarkably consistent across Western populations, where sigmoid colon involvement predominates over other sections of the large intestine. However, it's crucial to understand that the presentation can differ based on geography and ethnicity, with Asian populations more commonly experiencing right-sided diverticulitis. The European Multi-Society guidelines emphasize an important caveat that could be life-saving to recognize. In older adults, particularly those over 80 years of age, the pain may be less pronounced or even absent entirely. This doesn't mean the condition is less serious, quite the opposite. Elderly patients are more likely to present with atypical symptoms, making diagnosis more challenging and potentially delaying critical treatment. 2. Nausea and vomiting. Nausea and vomiting represent significant gastrointestinal symptoms that frequently accompany diverticulitis and should never be dismissed as simple stomach upset. These symptoms occur because inflammation in your colon triggers a cascade of responses throughout your digestive system. When diverticula becomes infected or inflamed, your body responds with systemic inflammation that affects normal digestive processes. The mechanism behind these symptoms involves your body's inflammatory response disrupting normal gut motility, according to the Stanford Digestive Health Study. Motility refers to the coordinated muscle contractions that move food through your digestive tract. When inflammation occurs in the colon, it can create a domino effect that slows down or alters normal digestive function throughout your entire gastrointestinal system. Clinical studies show that nausea and vomiting can occur in both uncomplicated and complicated diverticulitis, but their presence often indicates a more serious situation. Uncomplicated diverticulitis means the inflammation is contained within the colon wall, while complicated diverticulitis involves additional problems like abscesses, perforations, or obstructions. The timing and severity of these symptoms provide important clues about disease progression. Persistent vomiting, especially when accompanied by inability to keep fluids down, suggests a more serious complication that requires immediate medical attention. This could indicate developing complications such as bowel obstruction or severe systemic inflammation that needs urgent intervention. 3. Fever and elevated temperature. Fever represents your body's systemic inflammatory response to infection and serves as a significant indicator of potential complications in diverticulitis patients. When bacteria from your colon invade the inflamed diverticular pouches, your immune system responds by raising your core body temperature. This fever response is an ancient defense mechanism designed to create an environment less favorable for bacterial growth while enhancing immune system function. Multiple studies document fever as a key diagnostic criterion for diverticulitis. The American Family Physician reports that patients with acute diverticulitis may present with left lower quadrant pain, tenderness, abdominal distension, and fever as a constellation of symptoms. This combination of findings helps healthcare providers differentiate diverticulitis from other abdominal conditions that might cause similar pain. Clinical research shows that fever occurs in conjunction with other systemic signs of infection and inflammation. These systemic signs include elevated heart rate, increased breathing rate, and general feelings of illness or malaise. The presence of fever indicates that the inflammatory process has progressed beyond localized colon inflammation to affect your entire body's systems. However, the absence of fever doesn't rule out diverticulitis, and this is a crucial point that could prevent delayed diagnosis. Research indicates that fever may be absent in 20 to 40% of patients, particularly in specific vulnerable populations. Elderly patients represent another group where fever may be absent or minimal despite significant disease. As we age, our immune system's ability to generate fever responses diminishes, a phenomenon called immunosenescence. This means that older adults with diverticulitis might have serious complications without the typical fever warning sign. 4th, changes in bowel habits. Altered bowel patterns represent a frequently observed manifestation in diverticulitis patients, presenting as either constipation or diarrhea, and sometimes alternating between both conditions. These changes occur because inflammation in your colon disrupts the normal coordinated muscle contractions responsible for moving waste through your intestinal tract. Understanding these changes can provide crucial early warning signs of developing diverticulitis. Recent research has revealed surprising insights about bowel movement frequency and diverticulitis risk that challenge traditional medical thinking. A large prospective study published in PMC found that more frequent bowel movements appear to be a risk factor for subsequent diverticulitis development. This finding contradicts the long-held belief that constipation was the primary bowel-related risk factor for diverticular disease. The traditional theory suggested that constipation led to increased pressure within the colon, causing diverticular formation and subsequent inflammation. However, this new research suggests that increased bowel movement frequency might indicate underlying colonic irritability or altered gut microbiome composition that predisposes to diverticulitis development. Studies show that patients with chronic diverticulitis frequently present with obstructive symptoms that significantly impact quality of life. Research documents that 36% of chronic diverticulitis patients experience constipation, while 21% report decreased stool caliber, meaning their bowel movements become noticeably thinner than normal. This narrowing occurs due to inflammation-related swelling that reduces the effective diameter of the colon. These bowel habit changes often develop gradually, making them easy to dismiss initially. 5. Abdominal tenderness. Physical examination findings of abdominal tenderness serve as crucial diagnostic indicators that healthcare providers rely upon to identify diverticulitis and assess its severity. Tenderness refers to pain experienced when pressure is applied to specific areas of your abdomen during physical examination. This tenderness occurs because inflamed diverticular pouches make the surrounding colon wall hypersensitive to pressure. Clinical research consistently documents abdominal tenderness as a key physical finding in diverticulitis diagnosis. The British Medical Journal's best practice guidelines specifically list tenderness in left lower quadrant as a primary diagnostic factor that physicians should assess. This tenderness is typically most pronounced directly over the inflamed area of colon, usually in the left lower abdomen for Western populations. Studies show that abdominal tenderness may be accompanied by additional physical findings in more severe cases. Rebound tenderness occurs when pain intensifies after quickly removing pressure from the abdomen, indicating peritoneal irritation. Guarding represents involuntary muscle contraction in response to examination, where your abdominal muscles automatically tighten to protect inflamed internal structures. Research indicates that older patients are less likely to demonstrate classic tenderness, rebound, or guarding, making diagnosis significantly more challenging in this population. This age-related difference occurs due to decreased pain sensitivity, altered immune responses, and changes in abdominal wall muscle tone that naturally occur with aging. The absence of typical physical findings in elderly patients can lead to delayed diagnosis and increased risk of complications. 6. Leukocytosis, elevated white blood cell count. Laboratory findings showing elevated white blood cell count, medically termed leukocytosis, serve as important diagnostic markers that reflect your body's immune system response to infection and inflammation. White blood cells, also called leukocytes, are your body's primary defense against bacterial invasion. When diverticulitis develops, these cells multiply rapidly and migrate to the site of infection, resulting in elevated levels detectable through blood testing. Research consistently shows that leukocytosis is a significant finding in diverticulitis patients. A comprehensive laboratory study published in Medscape reports that a hemogram may reveal leukocytosis and a left shift, indicating infection. The term left shift refers to an increase in immature white blood cell forms, suggesting your bone marrow is rapidly producing new cells to combat infection. The normal white blood cell count ranges from approximately 4,000 to 11,000 cells per microliter of blood. In diverticulitis, counts often exceed this normal range, sometimes dramatically. However, the study also notes a crucial limitation. 20 to 40% of patients have a normal white blood cell count, particularly those who are immunocompromised, elderly, or have less severe disease. Clinical research examining 237 patients found significant differences in leukocyte counts between older and younger patients, with older patients showing lower inflammatory responses. This age-related difference reflects immunosenescence, the gradual weakening of immune system function that occurs with aging. Consequently, elderly patients may have serious diverticulitis without the expected laboratory abnormalities. Studies indicate that white blood cell counts greater than 10,000 cells per microliter were present in 62% of patients with CT-confirmed diverticulitis. Importantly, higher rates of leukocytosis were observed in complicated cases, meaning those with abscesses, perforations, or other serious complications had more pronounced white blood cell elevations. Thank you for watching and supporting our work. If you found this helpful, please give it a like and subscribe for more content like this.